Well, my research is in an interesting area, I think, developing an infectious disease. As you read more about antibiotic resistance and problematic pathogens worldwide, I think it's an exciting time to be in antibiotic development and antibiotic resistance. My research mostly focuses on translating the patient setting or what we see in patients back into the laboratory, trying to make solutions for those patients and bringing that back to patient care. One of the things I'm currently working on is as we learn about antibiotics, you have patients that respond to antibiotics and those that don't respond to antibiotics. And the organisms that we're treating seem to be sensitive. So our question is, why do patients fail therapy? And so we're trying to get into the groundwork of understanding maybe some immune responses in patients that can lead to antibiotic failure, and whether or not we need to use antibiotics effectively in patients that have underlying immune deficiencies that are not present in their disease state. And so kind of getting a basis of their immune responses up front and then merging our antibiotic therapy into that response is an area that we're starting to develop, and we've recently published some papers in that area. And that kind of brings it all together as far as using antibiotics and managing patients and the teaching side, understanding why we give certain antibiotics to certain patients. And then there's a lot of work that students can do on the investigator perspective too. It's impressive to see the interest of students that are in their first through their fourth years as far as learning different research techniques or understanding some of the clinical questions and research questions that are out there. You can read in the textbook how antibiotics are used, but seeing them actively used in complex situations where maybe a textbook setting wouldn't apply in every patient. And so understanding the diversity of the patients to apply the antibiotics as far as treatment, and then taking that back into the classroom and telling students that this is the ideal way to treat patients, but in the real world, sometimes ideal situations are not available, and so you have to be creative in how we use them. We have world-renowned physicians that are practicing. We have a unique patient population, such as transplant patients, other immunosuppressed patients that present unique antibiotic and treatment challenges. So that brings in kind of an exciting area to practice and to do research in. And then the resources here, I think, are second to none. So if we need anything on campus, we want to collaborate with other investigators. It's a highly collaborative environment, and the resources that are able to do that are really outstanding.